In this section, we'll be talking about migraine variants. There are some different sorts of migraines that may not even involve headache, and then some conditions that go along with headache in children. A first sort of migraine variant, which I see occasionally in the office, are abdominal migraines. These are episodes lasting somewhere between 1 and 72 hours, much like migraine headaches. Include mid-abdominal pain with some nausea and vomiting. A typical sort of story for a patient that I see in the office with abdominal migraine is a child who comes in, usually with a family history of migraine, parents that have had migraine headaches, have had these unexpected abdominal pains, discomfort, nausea, have usually undergone extensive testing and evaluation for gastroenterological causes for their abdominal pain, and all the tests and all the treatment have been unrevealing and unsuccessful. And then someone will think, well, I wonder if these are migraines, and refer them to me. So this is a very under-recognized cause for abdominal pain, these abdominal migraines. Now, what's very satisfying for me is that the medications which treat and prevent migraine headaches in children will often work in treating abdominal migraines in children. So after many months or years of and lots of tests, we might call the $1 million workup for abdominal pain, often starting a course of treatment directed towards migraines will help with the abdominal pain. What I like to have in children to confirm this diagnosis are things like family history and maybe even the child having some typical migraine headaches to go along with these abdominal migraines. A second sort of migraine variant is benign paroxysmal vertigo of childhood. These are little episodes of vertigo or sense of the environment spinning or disequilibrium where children feel off that come again in episodes. These little episodic spells of dizziness where parents will see that children, usually younger children, may not be able to walk or older children having disequilibrium or problems with their balance and seem to come and go for no apparent reason. Many times these children are diagnosed with things like malingering, thinking the older kids are just faking it, or in younger children worrying about things like seizures. They'll often have EEG tests and neuroimaging and other sorts of diagnostic studies directed towards the dizziness. They've usually seen an ear, nose, throat doctor to rule out things like benign paroxysmal positional vertigo and other causes of vertigo. Actually, it's a migraine variant. Now, this is a diagnosis of exclusion, and when I have a child come in with episodes of dizziness, I'll often order a lot of the tests to rule out more serious causes. But again, another under-recognized migraine variant is this benign paroxysmal vertigo in children. Another interesting migraine variant are ophthalmic or ocular migraines. This is where you have the vision changes. It may be the vision changes much like a migraine aura, like I talked about earlier. Zigzag lines, blurred vision, complete loss of vision in one eye, with or without having the migraine headache. Now, ocular migraine, again, is a diagnosis of exclusion. For these children who have these paroxysmal from out of the blue vision changes, we'd almost always want to do some sort of testing, usually involving an ophthalmologist. But at the end, having ocular or ophthalmic migraines comes down to things like family history, having some sort of typical sort of migraines in children, and then the rest of the studies and testing being unrevealing. In addition to migraine variants and other things that can look like migraines, there's conditions that tend to go along with migraines. It's usually mood disorders, and where I see this most often is in adolescents who have chronic headaches. There's an association here with depression and migraines that probably has some sort of neurochemical basis to it. We know that's true because the medications we use to treat both depression in children and some of the medications we use to treat headaches in children are the same. So there's a neurochemical basis to this. But then also, there's more of a behavioral basis to it also. A person who has chronic headache is likely to have a depressed mood. So when I'm talking to families of a child who has a depressed mood and also have headaches, I'll explain that it's more typical or more expected to have a depressed mood if you've had chronic headaches than to be upbeat and to not care about it. And significant disabling headaches a normal response is to have a depressed mood. So they're related that way. And in another way they're related is that people who have a depressed mood, their pain is often exaggerated. And so it's hard to figure out sometimes what came first, chronic pain causing the depressed mood, or depressed mood, which makes the chronic headaches seem more severe than they actually are. Sometimes we step back a little bit and we just treat both. We direct some treatment, not necessarily medications, towards the headache, and then maybe do some things for the depressed mood also, things like counseling, possibly some medications, but very commonly comorbid, well-studied, reported over and over, to have a very strong concordance, or these two conditions tending to go together.